Awesome. Thanks. Awesome. Thanks, Cindy. Good morning, everyone. For most of you, you probably heard me crack the joke already. I know everybody's excited to hear about the insurance world, but really, we're just going to tell you a little bit more about ourselves and kind of go into detail. Those that join the new hire or new member orientation every month, they probably get this in a condensed 5 minutes or less, probably 2 minutes or less spiel when I talk to the new member orientation every month. But we're going to dive in a little bit deeper, but kind of go through everything. And at the end, if you can just hold questions and comments at the end, and we'll open up and be glad to talk to you. So, number one, benefits connection. More importantly, we're Allen Insurance Group. We're the broker of record for a program called Benefits Connection and have been since 1980. And we'll kind of talk about what we do throughout this presentation. So before we even get started, this is a list of our current partnerships in the area. Basically, we're a large voice for small businesses and small chambers and different things like that. So it helps us negotiate unique contracts with carriers and stuff like that. And obviously, Central Delaware Chamber is one of our big members. And obviously, we're talking to you today. So today we'll just kind of we call it the Beyond Coverage segment. We'll talk about Delaware Employer Action Plan, navigating new laws and benefits, the scope of laws on employee benefits, and different things have changed a lot in the last year or two here in Delaware. So we'll kind of touch on that as well today. So in the next 30 minutes, I promise it won't be 30 minutes, probably be shorter than that going through this, but we're going to talk about how you can stay compliant ahead of deadlines with the latest Delaware paid family leave rules. Understand the Delaware earns. Those two things were just passed the last couple of years, so we're still educating our members on those things and making sure they're abiding the guidelines on those. And we'll talk about different alternatives that may or may not be better for your organization. We'll also talk about flexible tax advantage health benefits with an ICHRA plan. A lot of people may have not heard of ICHRA, so we'll talk about that briefly, as that's another option to offer health benefits to your employees. And basically just help you build a more competitive benefits package with moderate options. We like to think we're kind of unique compared to a lot of other brokers in the area. We have a lot of out-of-box ideas that help save money. And we like to be more proactive with our system, with our things that we bring to the table versus being reactive. So you'll learn about that as we go through this. So first, we'll talk about the Delaware paid leave, and I'm going to hand that over to Jolie so she can kind of go into detail about this.
Thanks so much for having me. Hey, Scott, I just want to make sure we're sharing the different parts of the PowerPoint presentation. It's still showing the benefits connection. So if you can maybe slide down to paid leave.
Yeah, I'm clicking right along on my side. I apologize.
There we go.
Yep.
Great.
So sorry about that. I had it planned on mine, but it wasn't going through. Okay.
Okay, no, great. Thank you. Yeah, so in 2022, Delaware passed legislation that created the Delaware Paid Family Medical Leave, and it was created to ensure employees in Delaware have financial support if they need to take time away from their job to deal with a serious life event. Now, these life events can include parental leave to care for a newborn child. It could be both maternity leave and paternity leave, medical leave to address a serious medical condition for yourself, family caregiver to help with a family member who's dealing with a serious health condition, and exigency leave to assist with a family member related to a military deployment. Now, in order to be eligible, actually, we're going to go back. In order to be eligible, you need to work 1,250 hours and work for your employer for 1 year. And that the 1,250 hours is equivalent to 25 hours in a week. And the benefit is 80% of your average weekly salary, up to $900 per week. And the duration for parental leave, you're allowed 12 weeks in a 12-month period. And for medical, family caregiver, and exigency leave, you're allowed 6 weeks in a 24-month period. And if you need to use more than one of the benefits, there's a combined maximum benefit of 12 weeks in a 12-month period. The Delaware Paid Family Medical Leave also offers job protection. So it allows to reinstate to a previous or equivalent position when you come back to work, and also allows for continuation of health insurance benefits. The benefits go into effect of January 1 of 2026. Now, Delaware offers both a public and a private option for the coverage. And there was an open enrollment period this time last year, September 1 of 2024 to December 1 of 2024. And employers were allowed to choose either public or private option. We found almost all of our clients chose the private option. And that is because they needed, if you chose the public option, you need to start paying a payroll tax starting January 1 of 2025 for benefits that don't go into effect until January 1 of 2026. Another big reason they chose the private plan is because with the public plan, employers are responsible for managing all claims. So they need to decide if the claim is an eligible claim. They need to decide how much the employee is going to get and for how long. And they all have to do that while remaining compliant. There's certain guidelines and timeframes that the state mandates. And if the employer is not compliant, they could be fined. So for these reasons is why we found most of our clients chose the private option. They wanted to transfer risk and responsibility onto the private insurance carriers and not have that burden on themselves. And the good news, and also they don't have to start paying premiums until January 1 of 2026. And the good news is that it's not too late to go private. There is a new open enrollment period starting October 1st that runs through December 1. So if you're interested in learning more about private options, please let us know. We'd be happy to help you. We also want to make sure you're aware of the latest updates. In August, they updated some of the legislation. So for Delaware employers that have less than 10 employees, they're exempt. They do not have to offer the coverage. With employers that have 10 to 24 employees, they must offer just the parental leave. And if you have 25 or more employees, you need to offer the full benefit. So the new legislation, when it first came out, said that however many employees you have starting at the beginning of the year, you need to offer that coverage for the entire year. Now, the new update states that at each start of the quarter, they will calculate how many employees you have. And if your threshold for what you need to offer changes, you can change your level of benefit. But you will need to give 30 days notice to your employees. And once you've given that 30-day notice, the new coverage will start at the beginning of the next quarter. Another update is payroll contribution rules. No paid family medical leave deductions can be taken from paychecks once you leave the employer. So they can't take paid family medical leave out of severance, paid time off, or final checks. And the legislation also now allows employees to choose to get taxes withheld from their benefits. It can take 10% for federal and 3% for state.
Thanks, Jolie. So again, at the end, we'll be glad to talk about each one of these topics as needed. We'll open it up to you. So the next one I'm going to talk about is the Delaware Earns. So who does this affect? Businesses with 5 or more employees. Employees working in the state of Delaware. Exempt or less than 5 employees, obviously, or if you have already offer a qualified retirement plan or government entities. Know your options. So just like the DPFML, this is basically the same thing. You have your public option through the state, and then you can also go private. If you elect a public, the state's going to help manage that, and it's a Roth IRA. I'm sorry. Option 2 can be through the private option. It can be a simple IRA, 401k, or any qualified retirement plan. The pros and cons for the public option: pros, easy to set up, payroll integration compatibility, no employer costs, employees will enjoy retirement savings. Cons, no tax advantages for your business or the employees for that matter. Historic performance of the funds may or may not be better than the private plan. State involvement in your retirement plan. The contribution limits on a Roth IRA are typically much lower than a 401k or a Roth 401k. Employees may not see it as a true attraction retention, as they can easily set up their own Roth IRA. Pros and cons on the private. We use what's called a PEP through our Benefits Connection pool. Basically, it's a pooled employer plan. So we use a grouping of employers to help lower costs and stuff, potential tax benefits for the business, potential tax benefits for the employees. Setup costs can be tax deductible for the business, higher deferral limits, increase retention and attraction for employees, reduce administrative burdens, significantly reduce administrative costs, significantly reduce responsibility, liability on the employer, national pooled employers, individual financial education consultant. So we'll actually have agents come out to your business, educate, sit down with your employees individually, and help them consult through these elections. Cons, there is an upfront cost to the employer and administrative responsibilities. Three things to really remember when you're looking at this public versus private. The Benefits Connection PEP solution is designed to make retirement plan business simpler for you and your clients. Fiduciary outsourcing significantly reduces investment fiduciary and administrative fiduciary responsibilities for the employers. So we're really taking that liability and burden off your desk. Economies of scale pricing. The pooling of assets allows businesses to enjoy economies of scale, so they are not purchasing as an individual business and they're part of a larger collective group. We've seen significant savings on just on the administrative cost side alone. We've seen 30-40% savings sometimes. So if that's something you want to look into and want us to talk to you about or see what we can do for you, we'll be more than glad to do so. So now I'm going to kind of shift gears to where we specialize in employee benefits, your health insurance, dental, vision, all those great benefits you put in place for your employees. Just to tell you a little bit about what's happening in the market on the health insurance side. The health insurance marketplace in Delaware, first thing I always mention, a lot of people don't realize this, but Delaware is probably I believe it's the third highest cost state now in the country when it comes to healthcare, and that trickles down to health premiums, obviously. So we always are trying to be proactive, helping our clients save money and look for better options for them. Highmark on the individual side has been approved for a 25% rate increase for 2026. So get ready. Unfortunately, that's coming on the private side through the healthcare.gov. You're going to see a 25% increase on those individual plans. Small group, they've submitted for 22.73. It will be approved and finalized in October. We'll have the final numbers then. But again, significantly higher increase. So we like to bring a lot of different options to try to shop that around and see if we can save those numbers for you. We have many different carrier options within the market, group health insurance versus individual health insurance, fully insured versus level funding. ICHRAs, I mentioned that in the beginning. That's something we'll talk about here in a second and kind of tell you how that works and what they are, what type of business can best benefit from an ICHRA, and what are the options available in the marketplace. So with that being said, I'm going to hand it back to Jolie and have her talk a little bit about the ICHRA, and then I'll wrap up at the end.
Yeah, so ICHRAs are individual coverage health reimbursement arrangements. It's a way for employees to go out in the individual marketplace and purchase insurance, and the employer can contribute towards those benefits. Now, it used to be when the Affordable Care Act came out that this was not allowed, that employers could not contribute towards the individual marketplace. But now to a new recent executive order allows this through a product called an ICHRA. Now, the way it works is the employer sets the budget. So they choose a particular plan and they say that they're going to offer a percentage of that plan or a flat dollar amount. And the employee knows how much money they have to go out and shop on the individual marketplace. And it offers a lot of flexibility. They can choose a richer plan and contribute more money towards that plan, or they can choose a lesser plan and potentially have a cost savings. And if there's a savings, they can put the money into what's called a health wallet, and they can use that money to go towards qualified medical expenses. So very flexible. Employees like it because they can choose the plan that best suits their needs, and also allows employers to set classes of employees. So managers can have a certain plan, part-time employees can have a certain plan. So it offers a lot of flexibility. Who benefits most from an ICHRA? Small to medium-sized businesses that want to offer benefits but avoid group complexities. Companies with remote or multi-state employees. We partner with a third-party administrator, and they are licensed in every individual marketplace in the country. So if you have an employee in another state, it's great. They can go out into their individual marketplace and shop. Employers with variable hour or seasonally workers. With group plans, you're really limited. You can offer to full-time employees, but with ICHRAs, you can offer to part-time employees, you can offer to seasonal employees. And it's also great for businesses looking for budget control and flexibility. Why employers are making the switch to ICHRAs? It offers more flexibility. Employees choose the coverage that fits their needs, lower cost. You set the budget, not the insurance companies, and personalized options, tailored coverage instead of one size fits all. So we're really seeing this as a game changer.
Thanks, Jolie. So kind of in closing, just a recap on the benefit side, some of the things we bring to the table that are unique. With health insurance solutions, we represent all the carriers in the state, ACA qualified plans, HMO, PPOs. I don't even really talk about EPOs now because they're kind of gone. Most plans have that out of network coverage. HRA plans, gap supplemental plans, plans with various deductibles and copays, alternative funding options available. And one thing I'll mention, so a lot of people are very familiar with a fully insured marketplace. We also have level funded program. We have a unique program with Aetna called Affinity Program. And this, coupled with some of our other great ideas, we can typically see, I've seen as low as 10% up to 20, even 30 or 40% savings on premiums when we go to market with our groups and compare it to the fully insured programs. Same good coverage, just a different way of going about business with your medical insurance. So we'd love to see if we could help save you money in that aspect as well. Our dental and vision options are a large group option. We shop this around with our partners. We use the pulling power of all our clients and get large group negotiations with our dental carriers and our vision carriers. So we bring that large employer group benefit down to the small businesses, and we'll work with businesses all the way down to one employee. We also have legal ID protection through Legal Shield. So this can be a payroll deducted benefit. Typically, those are employee voluntary funded, but you can make those available to your employees as well. We have unique workers' compensation, pay as you go through Hartford, self-insured options through BBSI. And again, we represent all the carriers. So we can try to shop around and see if we can save you money there. Vitable is another unique thing. This is new, not really new to us, but we're finding it new to our market. We've been partnered with Vitable for over a year now, almost 2 years probably. But basically, it's I call it telemedicine on steroids. So it's a unique way to set up and save money on your health insurance. You can cut out the claims that your Aetnas and Highmarks would normally see by using Vitable. You can do virtual, in-home virtual visits, or in-home and or virtual visits with no copays. It helps with mental health, chronic care included. They have over 1,200 prescriptions, and they do labs free of charge. So I'm a Vitable client. I have a high deductible medical plan. The way it helps my family when I do my annual physical, if I go through LabCorp with my medical insurance, it goes towards my deductible. I typically have to pay a couple $100 for that blood work. But now with Vitable, I can have that same blood work order through Vitable. I can still use my brick and mortar doctor that I like, but I can get that same blood order through Vitable and have that report sent to my doctor's office, and that's no charge. So by using Vitable for my blood work. And those maintenance drugs, like I said, they have over 1,200 free prescriptions. So your generics, your maintenance, cholesterol, high blood pressure, the most common drugs out there that people take on a daily basis, you can typically find them free through the Vitable program. So that's another awesome benefit a lot of our small employers especially are offering. It's good for large employers too, but those small employers that might not do health insurance yet may look at Vitable as an option. We also offer group benefits, group disability, group life. We shop all the carriers. And then for all our members, one of the things that's unique to our chambers and their members, we do Employee Navigator set up for free. It's basically a free HR portal. It can help keep track of all the enrollments. The employees all have their own login and can manage their benefits right through their own HR portal, and it eliminates a lot of paper trail. So that's another unique thing we bring to the table. With that, I am all done. It wasn't 30 minutes. I think it was about 20 minutes. So we are free to answer any questions or comments if anybody wants to speak up. And also, I'll put this little QR out there. If you do want to schedule a call with us, definitely scan that, and look forward to talking to you.
Thank you. We appreciated the information.
It's a mouthful first thing in the morning.
Yeah.
But I always like to sum it up. I mean, my little 2-minute elevator speech when I'm talking to the new member orientation is we're a general broker, but because of the power to pull in our members, we have unique contracts with a lot of our carriers where we can a lot of times save money where people don't realize they can save money. So even if you just want an extra set of eyes on what you're doing already to see if you had the best options, we're not always trying to take you from your current broker, but it doesn't hurt to have an extra set of eyes or make sure you're doing it right. And maybe we can save you some money, and we'll be glad to have the opportunity to do that.
It looks like Deborah asked a question. Yes, I do put this on our website under coffee coaching. Every coffee coaching we've done in the last few years is a link there. It usually takes a day to get it off the cloud and add it in there. So you're welcome to re-listen to this.
Was there another chat too? Or was that Deborah saying thank you?
Thank you.
Yep.
There was a lot of information in 20 minutes. Whoa.
Yes.
A lot to download.
Yeah.
Any other questions or? Everybody's too quiet this morning.
Yeah. It was useful.
So it sounds like insurance has changed a little bit.
And always changing.
Yeah.
We have to keep our pencils sharp, and that's for sure. It seems like as soon as we figure something out, they're changing something.
Yeah. And Delaware offers a lot more now than when I was there.
Yep. Yeah, I will mention, so we do work with employers all the way down to one employee. So your real estate agents, your self-employed, small employers with their business license, we can still do a small group health insurance quote for them. And that may be the way to go if they've been in the marketplace, seeing that big increase coming next year. So we can always shop that out as well. And our unique affinity program with Aetna, if they have 6 full-time employees, that's the size you have to be to qualify for that. But we can always get quotes on that as well. That's where we see a lot of savings because really their quotes are based on the health of their group and how they use the plan themselves. We're fully insured. It's based on the whole community.
Yeah, insurance is complicated.
Yeah.
Well, anybody else have any questions, or we still got time? You want to introduce yourself? If you haven't introduced yourself, we can have you introduce yourself.
I'm Diane Kearns. I'm with Delaware Municipal Electric Corporation. I've been here since January. So new to the industry and kind of newish to the area. Prior to this, I worked at DeSoto Falcon Jet up at the airport in HR. We closed and moved to Melbourne, Florida, which I wasn't going to do.
Is that where you're at right now in Florida?
No, I'm in Smyrna, Delaware.
Oh, okay. So you moved
Yeah.
from Florida.
No, her employer moved to Florida.
Yeah, my employer moved to
Oh,
Florida.
and you didn't want to move to
I
Florida.
did not move. No,
She stayed
no.
home.
That's right.
I get
Kids
it
and
now.
kids and grandkids, not going anywhere.
Yeah.
Awesome.
Yeah.
That's
So
how
you-
I ended up back in Michigan, because the whole family moved back and I filed right with them.
Yeah.
Yeah.
So you've had that HR hat on before.
I have been in HR for nearly 40 years. I spent
Wow.
27 years at one organization and then I moved to
Wow.
Delaware and yeah, I've
So you've seen the changes over the years.
yeah, for sure. You-
Yeah, I've been in the industry 23 years. So
Okay. So your what you stated about like small employers, and this is really a personal thing. My daughter is a real estate agent,
Mhm.
and I know she's on the marketplace, So, but she has a Delaware license, but she lives in PA. Can your organization
Yes.
assist there? Okay, I'm
Yeah,
gonna pass the information on.
we're licensed in the Mid-Atlantic area, and
Okay.
PA rates are going to be better in Delaware too.
Okay, okay.
So yeah, Delaware is one of the highest rated states, unfortunately, just because of the size and um, the hospital system's created a monopoly with healthcare costs, so it's driven the premiums up, as you can imagine.
Okay.
But yeah, we'll be glad to help, or at least that way she can compare the marketplace, to small group.
Sure. Thank you.
One thing going through the marketplace that small group doesn't offer is if an employer, even that one person, offers that small group plan, anybody that is on the marketplace that's an employee there that's getting a subsidy from the state, they lose that subsidy. Well, technically they don't lose it, but come tax time, the state's going to ask them to pay that back if they find out their employer was offering a small group plan. Obviously, it's just her, but I'm more
Right,
speaking to the
right.
group. If I'm a 5-person company and I decide to offer an affordable care plan, anybody in my company that rejects that and stays on the marketplace with a subsidy is in jeopardy of having to pay that back. And that's where when we sit down with the employer or decision maker, we talk about that and make sure they understand that. We don't want them to cause their employees to have a big payback come tax time. So we try to educate on those things.
Well, thank you for the information. This was all very helpful. I have to jump on another call. It was nice to meet everyone. Thank you.
Yeah, you too. Thank
All
you.
right, thanks. Have a good day.
Yeah.
Yeah.
Anybody else have any questions or
So
want to
this
say
is,
anything?
no, just, this is gonna be the new time now every month?
Yes.
Okay. Thank you. I have to leave too.
Yeah, thank you. Well, I want to thank our sponsors, Bavarian Inn and Tracer Dulce. And I'd like to thank Scott, Jacob, and Julie Houston for coming and doing this today from Ellen Insurance.
Our pleasure.
Thank you for having us.
Thank you. I'm gonna stop the recording here.